can 10 million naira do for you in this economy? Well, with an initial deposit of 10 million naira, you get to own a smart home. Lights, that's what I'm talking about. You get to own a smart home right here in Ajah with Flourish Duplex. Experience the pinnacle of modern living with automated smart homes at Flourish Duplex. A 4-bedroom, fully detached luxurious duplex with features such as a fully furnished kitchen, constant lights, CCTVs, smart locks, tight security, a serene environment in a gated estate. With a payment plan of 10 million naira initial deposit for a one-time payment or an instrumental payment that runs from 12 months or 18 months. Terms and conditions apply. So what are you waiting for? For more information, head to our website at www.flourish360.com.ng or send a DM to the number displayed on the screen to schedule an inspection. Make Flourish 360 your home, where we ensure long-lasting wealth and happiness. Come closer. Contact massively each time you engage with the app, just by liking, commenting, sharing, and inviting friends to our platform. As a business owner in search for talent or an individual in pursuit for employment, PP Chat has a segment covered for you. With PP Chat, you can trend and earn. Whether you're an entrepreneur or a business enthusiast, you can advertise your products, buy, and sell in the marketplace of PP Chat. Thank you. With PP Chat, you don't need to have thousands of followers before you can earn points. As long as you're an active user on the app, you stand the chance of earning points, which can then be converted to money. You just earn the points, right? When boredom kicks in, head over to an entertaining game session. On PP Chat, you get to trend, transact, and earn money. To sign up, log on to www.ppchat.com. You can also download on App Store and Play Store. PP Chat, trending beyond.
Hello, thank you. Welcome to yet another exciting day on the Kwa podcast. Thank you for subscribing. Thank you for your awesome comments. Yes, we'll be reading the comments, and trust me, on the comment section is where it's happening live. We've got a lot of positive comments, and we also got some very fine comments. So please, let's keep it clean on the comment section. So if you're not yet subscribed to our channel, do so right now, because all this content cannot be wasted. So rush to our socials, YouTube, Instagram, Facebook, and comment, engage, and subscribe, and also share. Thank you so much. So we'd like to thank those that have partnered with us over time for their continuous partnership. We'd like to thank PP Chat. We also like to thank Ikoyi Property. We also like to thank the Koa Event Center, Flourish 360, for partnering with us to bring this amazing show to you every week. Thank you so much. And our topic today is my body, my choice. Oftentimes we've had cases of people losing their lives as a result of BBL. Yes, a lot of people have lost their lives, but that is not to say that there are no success rates to this cosmetic surgery. You know, I think last week it trended on the social space about a lady who lost her life, and also I think there was a viral video last week again of a lady who talked about spending over 8 million for maintenance. So today on this show, we have a doctor in the house, and we also have Success Izugo Alingo to, I don't give her another name. I think last week I gave her Precious. So as I'm doing Ezugo and I'm adding Alingo to it, pardon me, I like to give people names. Okay, so let me just go straight to introducing my co-host. I don't think it needs an introduction again. So I'm here with Dr. David Ayiboswa. Hello, Dr. David.
Thank you one more time for being on the show. And to all our viewers, we want to appreciate you for keeping in touch with us. And we know that today is going to be awesome. Thank you, our delightable hosts, beautiful host, Lady D.
Ta-da! Dun, dun,
Yeah,
dun.
everybody knows that she's always looking for my trouble,
Dun, dun, dun.
but
Drum roll.
I'm coping. I'm coping with your trouble, but all the same, you're welcome, our viewers. God bless you.
Thank you, Dr. David. Okay, I would like to introduce our first guest. His name is Dr. Mark Alieze. Yes. Hello, Dr. Mark.
Hi. Thank you for having me on the show.
Can you tell me the meaning of Alieze?
Alieze means heaven
Wow.
in my dialect, my Igbo dialect means heaven.
Wow.
Yes.
That's nice.
Yes. Land of a king, basically.
Land of the King. Wow. I love that. Alieze. Wow. Thank you. Thank you for coming on the show. So, for you out there wondering, should I go for this? Should I not? I want you to adjust your seat. I know we ladies have a girl's thing, like, baby girl, I want to go for surgery. Let's save money so we can go together and feel the pain together. So please call that friend that you are planning to go on the surgery with, so that they can come and hear this, right? Call them, keep tagging them, tell them, oh yeah, let's come and hear about this before we decide whether or not to go. Okay, so our next guest is the delightful, the beautiful, the bold, and somebody on the comment section called her Mommy Gio. Well done. I will not give her Mommy Gio title. Or should I give you Mommy Gio title? Okay, so we have the beautiful Miss Success Adaugo. Like, I love the name. It's so prophetic.
My dad was very strategic.
As a Adaugo Ezogo, like Ugo.
Yes.
If you don't marry Ugo, you don't finish
Ugo
work.
Square.
As in UGO Square. So I'll call her Miss UGO. Hi, nice to have you on the show again.
It's amazing to be back here again. I feel so excited, happy. I mean, it's showing. So thank you for having me again.
And you have such a beautiful smile.
Aww.
Like such a, that's the smile you get before she begins to deliver hot. That's the smile you get. She first give you that charming smile and then bang.
They don't know what's coming.
Yes. Okay, so we're talking about my body, my choice. A lot of people, they say, oh, my body, my choice. I can do whatever I like with my body. I can use all kinds of things. Actually, it's your body, your choice. Yeah. But today we brought in a medical doctor who has been in the practice for quite a number of years. So he has had experience, general experience, and also because when we were talking backstage, he was telling me some things, and I'm like, oh, really? Oh, wow, is that right? As regards this topic. So, Dr. Mark, I would like to start with you. Can you give us like a full definition of BBL and an insight of what it's about?
Okay, so BBL, as we all know, short for Brazilian butt lift, is a procedure where fat is transplanted from various parts of the body to the backside. So, as the name says, butt lift, it is not technically a butt lift. It is fat transplant. So, a butt lift, for example, if you have a sagging skin,
Okay.
there is no way a Brazilian butt lift would sort that out. There's a separate procedure for that. So, basically, as I said, liposuction, meaning taking fat from, let's say, the abdomen, the thighs, the lower back, the hips, and transplanting it strategically to areas of the backside to give it a certain shape and contour to suit the demands of the patient. That is what a BBL is.
Okay, so what areas do they take? Is it like they can take the fat from any area, or there are some designated areas?
So when you come for a pre-procedure appointment with your potential cosmetic surgeon, they would map out several areas in your body where you have excess fat deposits. So let's say the general population, most people would have excess fat deposits in their tummy, meaning their abdomen. So when the doctor maps out this particular area for harvesting of the fat, he would definitely, of course, ask the patient if there are other areas of concern where she wants fat taken out of. Let's say some people might have extra fat pockets in their hip area, some might have in their thigh area. So when this appropriate area for harvesting is mapped out by the doctor, then they go for that. So what I've mostly seen is the abdomen because we have a large pocket of fat there.
Wow, the abdomen.
Yes.
Okay, so they remove from the tummy, the
hips,
the hip.
yes, to give it a very good hourglass contour for the lady.
My darling, what do you think about BBL?
Oh my goodness. Well, for me, just like I mentioned earlier when we were talking, my body, my choice. A lot of people would say it's my body, I choose whatever I want to do with it. It's nobody's business. But the truth is, oftentimes people sit to make choices because of now. They don't get to think of, okay, so when I'm done with now, what's going to happen tomorrow? I really feel a BBL is something that has worked out for some people, but the failure rate is so much and it's beginning to, be the talk of the town. So letting people know what they are going into before they go into it actually makes sense, which is why I'm so grateful for this particular episode, because there is a girl out there now that is seriously doing her job to go and do BBL. I mean, it's not something you just wake up and move. It's something you really need to sit down and calculate very well, yes, before you can make that move. So generally about BBL, apart from getting the fine body and everything, I really think there is more to BBL than just you having a fine body, and which is what people do not consider most times, that which is what people do not look at. So generally for me personally, I do not fancy the idea. I do not like it because I get it that yes, some people have insecurities about some part of their body and want to go under the knife for it, but I still feel like there are ways you could get results that you want on your body. It might take you a longer time, but the result is going to come instead of opting for going under the knife. I really feel it's a very serious matter, and personally, it's something I wouldn't like to do.
Okay, let's talk about the self-esteem. Could it be that this pandemic, I like to call it a pandemic because it's growing, the BBL industry is growing very fast, and a lot of quacks are cashing in on it.
Yeah.
Somebody can just wake up and say they've opened a clinic and people will rush to it, right? I'll still throw that at you because I want to know what the medical board is doing about it, because there are lots of cases of deaths so far, on the internet and all that.
Due to complications.
Yes. So would you say that this pandemic is as a result of societal pressure on the on the women to look in a certain way,
Okay.
or it's a social pressure, because social media would give you what perfection looks like, or it's just a self-esteem thing?
Yes, the answer is actually yes. Majority of people who go into this particular BBL, or who want to get it on their body, is actually as a result of pressure, what they see on social media. Now, this is why most times when I talk, I call out popular people a lot, celebrities. Sometimes you're a reflection, of what you're doing, but you don't even know. You don't know how many people you influence on a daily. So if you're making choices, most times it's affecting people. Now you, as the millionaire or billionaire, you can actually bear the consequences of the choices you make. But how about people who are looking at you? How about people who are watching you on a daily? So I really, really think that people who go into this BBL, half, if they are 100, in fact 80% are going in because they want to look like a particular type of way, or they want to look like someone. There is somebody they are admiring and they're saying, oh, if you see her shape, if you see her this, if you see her that, I will get that, whatever it costs. And now bringing it to the aspect of the quack doctors that are actually performing these surgeries without a perfect experience, this same pressure is what pushes people into going into, the cheaper places. Because getting a BBL, if you browse about it, it costs a lot of money, like a lot of money. But when these girls are actually seeing where they can get it cheaper, and maybe they've seen a result, yes, this person did it, no die, make I go do my own. There is no need for the pressure. Honestly, there is no need for it. If you think it's because of your self-esteem, then you should understand that there is more to self-esteem than even how you look. Because I've seen people who have flaws on their body, but the way they manage it will make you fall in love with it. Instead of you using it against them, you would begin to love it for them. So I feel this self-esteem thing has to do with yourself. If you're actually feeling low about something, how do you manage it? Don't let pressure push you into something that you know that you cannot afford in a lifetime. Because honestly, it's pressure. There is not, it's pressure. Half of the people who just want to do this for me is few. Majority is being pushed because it's everywhere. Every girl right now, their backside is massive. So everybody wants to get it as cheap as they can. So it's definitely the pressure.
I
Which
think it's
I don't see
very
the reason.
rampant
I
on
think
the island.
it's also the society norms.
Yeah.
It's how the society see things, and because of that, a lot of people are pressured to go into BBL. I want to ask doctor, because this topic is deeper than what we could say. For people to be going for BBL every time, that means they will have seen the positive side that maybe we are not seeing. What are the positive side of having a BBL?
Okay, so the first positive I would say is boosting their self-esteem. So when you look like that celebrity that you look up to, that you see on your social media feeds, and you see the way the contour of their body is, when you look like that, there's this I have arrived feeling that you get. Some people would do it for other sinister reasons that I won't go into
They'll do
now.
it so that they can be shaking what the doctor gave you on social media.
Yeah, so those are the two main reasons why, because there are no inherent extra medical benefits to a BBL, because it's basically just taking fat from one part of the body and implanting it somewhere else. So you wouldn't say, oh, okay, yes, I'm going to, oh yeah, you can lose weight in those parts of the body where fat is harvested from, but you can still gain that weight back. It is unlike other surgeries for weight loss, like a tummy tuck or like a gastric sleeve. It's not like that. This is a cosmetic procedure um, that is basically done to boost the self-esteem of the patient. No extra medical benefits.
Okay, so the other time, there was this viral case of someone lose. I think a lady came out on UpX and said that she went for this procedure with one particular doctor, a female doctor. She's late, by the way.
Yeah.
Yes,
Yeah,
she,
so it
and
online.
at the end of the day, it went downside. Like it just, she came out and some other persons came out. But at that point, I think we didn't hear anything done to the doctor because they said they signed a what now a consent form. And I think there was also a viral video of that particular doctor looking as though she was high, and people were criticizing the practice behind the surgery, what she was doing. Because at some point, I think I saw a video of her listening to one of those music while she was in the procedure. And then the thing went off. After some time, there was another news that someone died in the process by that particular doctor, and the case was taken to court, and I think they sentenced her, but then we didn't hear anything again until when she later died, as the doctor in question now died. So
doctor
are
too
they
died.
saying the doctor died?
Yes.
Yes, she died.
She's late.
Not as a result of BBL, but I think maybe she had a medical
Complications.
complications as a result of something else, and she died. So are there laws put in place to guide these practices? Because it looks like everybody is opening. It's now a business.
Yes,
Everybody
it
is now opening a small place
as small as it is,
to
budget
just,
by this, budget
yes,
by that.
yes, and people are going into it without even checking if this person is a licensed doctor, if this person is licensed to carry out this operation. Are there things kept in place by the medical, what do you call them now? The
Medical Dental Council of Nigeria.
Yes.
So I want to believe that the Medical Dental Council of Nigeria would have laws in place. But again, we all know the country where we're from. This is Nigeria, that anything can go. So you being a cosmetic surgeon does not mean you can do a BBL. So during training, you can train to be a plastic surgeon, yeah, and you were not trained to do like, let's say cosmetic procedures like a BBL. So you just saying, oh, I have I'm a consultant or a specialist cosmetic surgeon. Do you have other qualifications? So I'm going to talk about people going for BBL. When you go for a BBL, make sure you do a very good research on your doctor. So how many procedures have you done? You have to ask, are you board certified? In this case, MDCN certified? Or do you have other qualifications? Can you show me your success rate? How many patients have you operated on? Of course, no opening patient details, but how many of these procedures are successful? Can I see before and after photos of your surgeries? Not just the price or, oh, this person did it and it was fine. So you need to do a full background check on both the facility that you're going to operate on, the doctor, and the other members of the multidisciplinary team, because it's not just the doctor that is doing it. So you need an anesthetist that will put you to sleep safely. You need a post-op care team put in place, not just, oh, the doctor finishes, and it takes a multidisciplinary team. So you need to do a full background check before you sign any consent, because once you sign that consent, if you don't read the consent, but that is also something that could you could be liable for. So you need to do all that before you put pen to paper on consent and going under the knife.
Wow.
This is
This is what somebody is messing around with. Like, this is what people are messing up their life with.
From what the doctor is saying now, it means that the side effect of this
is even more. I feel
for there to be a consent form,
yes,
that should tell you that
not
not dead or alive.
Honestly.
50-50.
I remember when my husband wanted to do skydive. They gave him a consent form, and he was to sign it. And they told him, this is not in Nigeria here. They told him, what, we will not be liable. You break leg, we will not be alive. You die, we will not be.
Oh, really?
Yes,
Yes.
you have to
Wow.
sign a consent form. And all
Out
through
of my bucket list.
out
I do
oh
more.
please, all through he was in the sky. I was down Kabashi, Father. Let
Please
it not
protect,
be that thing.
save.
This one that I travel, I'm going back, you know. So for somebody that, okay, that one is just because it's in your bucket list, it's a one-time thing. And although they have system put in place, they
For
had an
safety.
expert
Okay.
with him,
Yeah.
you know, that is watching the whole thing. They have somebody filming, so they have an helicopter that is on standby, everything, the way he will land and everything. So that one was a complete success. But here, where we are, I don't want to, you know, see
Emphasize
ourselves.
on it.
Yeah, here where we are, those things,
Demonstration.
there is the life factor. Because I heard there was a particular man who died. I think he was a politician. He came to one of this place in was it FS1 to do a surgery. I think he did tummy tuck. He extracted fat, and I think he was doing tummy tuck when the light went off, and that was it for him.
My
That was
goodness.
it for him. So having to think that there are so many factors. Is either Musa at the gate did not buy enough diesel and diesel went off, and then someone can lose their life, you know, and then all that. Is it really worth it?
So to clear something up, you mentioned about the consent. So the consent in medical practice is a medical legal document that would protect the doctor and also ensure let you know what you're going into. So the consent would contain details about the procedure and possible complications. So it would also contain measures put in place to prevent or limit those complications. So it is not like oh, they're giving you something to so in case if anything happens. No.
So the person goes cost-free. It's just that to reduce the sentence.
No, not reduce the sentence. It depends on the particular case. If the doctor is found negligible in a complication that leads to a fatality, then the court or the MDCN would treat this as a particular case. But if the doctor acts in accordance with good medical practice and explained everything that happened, so I don't think the doctor will be liable. So the consent is not a bad thing. The consent form is not a bad thing in medical practice. It's not. As I think you guys mentioned that.
Because a lot of people say, should be they sign consent form. That's like a death warrant.
No, it's not. It's just a medical legal document to protect the establishment, the doctor, from any possible. For example, let's say you do a surgery and for let's say 6 months, nothing happens to you. You don't have any complication from the surgery. If something maybe goes wrong later that is not related to your surgery, someone can just come up and say, well, this doctor this person had a surgery 6 months ago. So the consent form would
Is what saves the doctor.
saves the doctor
principle.
that says, okay, listen, I explained everything,
Yeah.
and this patient did not have any complications
complication for this period
related to
of
my
time.
surgery.
Yeah.
So the doctor would not be held accountable. So that is what the consent form is for.
Let me ask us as a question, as a lady, because we know that BBL has to do with ladies.
Yeah.
It was only on backstage today that I heard that a man among all the men
Oh my goodness.
also went to do BBL, which I'm surprised. Do you understand? So will you advise, what is your advice for, or will you like to do BBL? Number one question. Number two, what is your advice for a lady that wants to do BBL? It's very important as a lady now, because we know that this is peculiar to ladies.
Yeah.
So what is your own suggestion, your own advice? And for you also, would
Personally.
you like to go under the knife?
Personally, I say it here. I'll say it tomorrow. I'll say it next tomorrow. I am not interested. The reason is because I have seen.
Something might come up tomorrow. now.
Yes.
What if
I
you
have
are
seen-
doing BBL promo?
I've seen
Because I
something
used to
might come
see a
up
lot of
tomorrow.
promo.
I've seen people doing.
Promo.
And I don't
Okay.
do promo now.
Okay,
If you're on
so-
social media, you see they'll do
Yes.
discount.
Okay, so
50%
there are
promo.
people who make choices. You know, there are people are different. But you see the success sitting here. You can meet the people I went to school with. some of the basic standards I have since school are still the same standards now. There are a lot of things that have happened in my life that are supposed to waive those standards, but it didn't waive it because that's the kind of person I am. First of all, apart from my being a disciplined person, saying, "Oh, I'm not doing this and I'm not doing it." Outside that, I don't like pain. I'm a very, oh God, I don't like injection alone. It tensions me. Like the fear of needle is the beginning of my, oh God, I don't like it. So even the suggestion of going under a knife to get a particular type of look is something I wouldn't want to do. I would not do. Do you get? I won't.
For now, of in the future.
For now, for later. This is a podcast.
What if,
This life
what
is
if
recorded.
what if your man tells you, baby girl, I think you should be in a certain way. Don't worry, I'll pay for it. Because these days, I think the pressure is coming from the mentor.
I'm actually going there because he asked me like a general question. So I'm going to like touch, every part of that. But this is like me saying personally, I'm not interested. And the reason I am not interested is because I have always been a person of alternatives. This is one solution. What is the second solution? What is the option? Because I feel in everything you want to do, there should be a plan B, there should be a plan C, there should be a plan D. So if A, B, C is not working, what's the next
option.
one? So since I do not want to go under the knife and I want a particular type of body, what is another alternative? There is
Other
definitely,
option.
thank you, there is definitely another option. Even when you go to the hospital, even before the doctors, I watch Bot a lot on the TV. Yes,
Yeah,
Bot, yes.
Bot.
On E. I watch it a lot. You will hear the doctor telling the patient, are you sure you want to proceed with this? Because there are other ways you could achieve this body. And you hear them saying, it's also part of the consent, if I'm not mistaken. It's also, and the person says, oh, I think I want to do it like this. Do you get it? So I always feel there's a second option. Please, I want this, but what is another means of getting it? Because if you look at a BBL, it's not something that is now, it's of tomorrow. And I'm not a person that makes a decision for now. I always look at tomorrow before I take my decisions. So if I do a BBL, I know there are going to be maintenance for this thing. I have to go back to the hospital to check. I have to be on medications often. I have to also be conscious. I'm not comfortable. I don't like discomfort. So I wouldn't want to put myself in that shoe. So for any young girl out there, this is my advice, and this is like me speaking for some ladies, because I know that I'm not speaking for everybody, but people who actually see life in the view that I see it, there is always a plan B. I understand that you have that insecurities. I understand that you want that flat tummy. I understand that you want that hip. I understand that you want that backside. But yes, there are other options that you could look out for, because BBL is very risky. From even what the doctor just explained, we're talking about knives, a lot of things. And then we're talking about the maintenance. If there is a complication, are you even willing to pay for this? Now, they just
So,
think...
wait, you went into maintenance now, backstage.
Yeah.
You mentioned some amount of money for
Then
maintenance.
I was about to say that now. Like, I was on TikTok yesterday, and then I saw a lady, somebody posted the clip of her saying that after going for her surgery that she paid millions of naira for, from professionals, she actually had complications. And for maintaining the complications, she said she spent over 8 million naira for the maintenance. And guess what she said that wowed me? She said, and I am not yet cured. I haven't gotten the solution. So she said, yes, that she's going back to, one of this country I don't want to mention. She's going back there to spend millions of naira again to maintain this. Now, this is something that you could have sat down and thought of a second or a better way. For everything, I keep saying, for everything there is a better. In fact, for every word, there's another word close to it that could be used to represent that particular word. So for you to actually go into this thing, please, my advice for you is to sit down and think about
That means
it.
to say that BBL is not for salary earners.
No.
Minimum wage salary earners.
Honestly, because it has a lot. You first of all, what's your stream of income? I mean, skincare for those people
What's
who
the
do,
purpose?
for people,
the
let
BBL?
me bring in skincare. For people who do skincare, for ladies who do skincare, they will tell you my skincare is 100 and something, my skincare is 200K, my skincare is this. And for each time that skincare goes down, there's always this pressure to renew it because they know, oh, this has been effective for me. I need to maintain this and I need to buy another one. Now, I used to ask people, before you go into this thing, skincare, what's your finances? Now, you see, I have a lot of friends who have skincare. They are business owners. I have a nail technician, my friend. She has this expensive skincare that she uses. Before it even finishes, she has ordered for a
Yeah,
new one.
can
Her
maintain.
finances
Can take care of that.
is maintaining it. Now, you don't have a finance to back this up if there is a complication. You don't even have the money to get the medication. Let's leave complication aside. Let's talk about the maintenance.
And BBL is not hundreds of thousands; it's millions.
We're talking about millions of naira. What are you doing to maintain this your body that you want to go and get? Are you depending on just let me go back to your question. You said men paying for this. So you're depending on a man, a human, on this maintenance, your husband or what? What if something should happen and the man can't give you that amount of money again? Or he keeps paying, and no perfect result. He's going to get tired. Nobody wants to be spending money on something that is not yielding results. Even the foolish ones.
It's not
they
an
don't-
investment.
It's amazing.
not an-
It's
thank you.
amazing.
It's not an investment.
It's amazing what people do to, get this done. I think I was seeing one episode of Mommy's therapy, that's Mommy Entertainment, and a lady used her children's school fees to go and do the BBL. By the way, for those of you wondering what Mommy Entertainment is, if you are not following that series, you're missing out. So Mommy's Entertainment is a comedic series of a therapist who handles several cases of issues. People bring issues to our table and then they talk about it. So I think one of the episodes that they had was a lady who used school fees. I think she used her children's school fee to do the BBL, and then because the BBL went wrong, one side of her body, sank, and the other part was one side. She had to sell her husband's land to do the maintenance as the aftercare. Yes.
You see what I'm saying?
Yes. So I want to
So
come
what's
to
the
you,
finances?
doctor.
It's very important.
Let's talk about the aftercare, because I think you've talked about the procedure itself. Let's talk about the complication that comes with the that comes after the procedure, and then the aftercare, because a lot of people just check. I think I've seen several posts on Instagram where they say discounts, discounts, consultation. And me too, I read a lot, I absorb so many things. That's why I'm always, there's no topic you bring before me that I don't know of. I think I went back to the page and I checked, and for the one I saw, I think there's a procedure for 2 million, 3 million, thereabout, and people will be like, okay, if I do XYZ, I
Money
can
for-
get
money
3
for land
million
in
sharp,
Efe.
and maybe I can add like a 2 million just for the
But
procedure.
this
That's
is very,
5
very-
million,
it-
and they don't prepare for aftercare.
We're talking about your life. Sorry to actually, we're talking about your life here. We're talking about human life. And my problem with some people is sometimes when you talk about topics like this and you're not really, in the financial level where you're supposed to be, you hear people tell you, forget that thing now because you never get the money.
You're very
You're
correct.
go- you will
You're
see
very
it.
correct.
You will see it on
It
the
will appear
comment
on the
section.
comment section too.
Leave that in where they talk. She never get the money. It's not the money. Like I mentioned earlier, you have to, for everything you want to do that has to do with your life. So far as you're not dead yet, the life is important to you. So for every decision you're making about your life, you have to be very, very careful about it. It's not just about now. If you go use the 8 million naira, 9 million naira and get the body done, what is your plan if something goes wrong? What is your plan for the maintenance? So you see, it's not just about the body. So instead of going about it this way, I understand you want to have a very beautiful body. Why don't you ask your doctor for other measures? Let me bring in the gym. The gym has given people perfect bodies over the years. It just takes time. So may I just
And it's
switch
cheaper.
and say that
It's super.
yes, may I just switch and say that BBL is not quick. It's not let's go and get the body done. Let's show them. You're not showing anybody anything. You're not showing. You have to sit down and think of it. Do I have the money to? Do I have the money to take care of myself after this? If there's a complication, what am I gonna do?
So let's take from the doctor what she asked you.
Okay, so let's get your view on the
Complications
the
and aftercare.
complication. Yes.
Okay, so there can be intra-op complications, meaning during the surgery. You could have a cardiac arrest. So
Wow.
Crazy.
so this can happen spontaneously, or this can happen if, let's say, an anesthetic agent, something that is used to put you to sleep, maybe a little overdose is given by the anesthetist. It can just send you over and you're gone.
Wow.
So that
To
is
meet the Lord.
so that is the first one. Bleeding, of course, during the surgery. This, of course, can be taken care of with a transfusion and so on. Then let me talk about the after surgery complications. So the major one, or the main one that is quite known, is what we call fat embolism. So the fat that is being transferred can actually get into one of the tiny blood vessels and travel to your lungs and block the normal airflow, and that could be fatal. So that is the major one, because we're dealing with fats here, right? So if the surgeon puts this fat in a certain layer of the body, so normally BBL is called safe subcutaneous buttocks augmentation. Okay, don't mind that. So if the doctor puts this fat under the muscle layer, the patient can get this fat embolism. This is the major, one of the most common side effects. Then you can have, of course, infection of the sites, which can be taken care of with an antibiotic. And sometimes the infection can be overwhelming, and it can be sepsis, which is like a whole body bacteria invasion. There are other common complications, like the lady that you're talking about on social media yesterday. She had a fat necrosis. This can occur weeks after the surgery. So this is necrosis is death. So the fat that is put in these pockets in the backside can actually start to die off if they don't get enough blood supply there. And when they start to die off, you need to take them out. So they need to go again, open it up, and bring them out. So that is the
And you
maintenance
pay for
system there.
that.
I don't think it's free. So that is the maintenance, because they will still have to take some fat to put back there, because if you bring it out, it's not going to give
You
the
can't
shape.
leave it.
No, you can't leave it. It's dead.
So they take it out and they keep. No wonder you will see some kind of ass. It looks like you know that
After some
sugar
time.
ants. You know that sugar ant shape.
Oh.
Where the butt, the
It's
the
giving.
back side is giving, but the thigh is looking like tristic. You know, there are some you see like the other day I was at a hotel, and I and one of my colleagues, we saw one butt and we said, no, this is too good to be true. There are some you will see it's a success rate. You can vouch that this person did not do anything because it looks very normal. And there are some that looks like
Now,
SpongeBob SquarePants.
I wanted to actually go in there. You see, what would finish most Nigerians is greed. They always want to. Some Nigerians always want to do too much, and it's not good. Honestly, there are BBLs. There are people walking everywhere with BBLs. It's BBL that gave them the body that they have, but you will never know. You could swear it that this person didn't go under the knife. Very mindful, very demure, very perfect. Why? There are some, when they get there, I want it big. Anyhow, you can make it look so obvious that I came to this hospital.
Yeah.
Do it. And now you're not considering your body size. You're not considering your legs.
Your
You're not
thigh.
considering, BBL is like a makeup. It's like a makeover. It's like a lady when you put on a makeup on your face. We all do nails, do lash, get to do the hair just to look, just to add up
modify
to
your
the
look,
natural
yeah.
look. So I feel that's also what a BBL should look if you want to get one. You should try and do something that is a little bit convincing that this is what God gave you.
That's
I mean,
right.
somebody could, and at the same time, you have this banging body, you have this banging backside. Why would you want to have big eye? To go for that one that after going for it and come out, people are saying the way you were looking before is better than now. But people are supposed to see you after a BBL and appreciate what you went to do. But rather, you're being dragged, everywhere for that particular choice. So please, if you're a lady and you're listening to this and you have the money to get a BBL done, you have money ready for complications, you have money ready for maintenance, and you want to get it, please make sure you look at your body size and get something perfect, something neatly done, that when they see it, they'll say, yes, the doctor who did this did a nice job. Don't always go for the one that is so obvious that people are going to think, where's this one coming from? That's what you were saying, tiny legs, coke, you're big or big.
You mean after this whole talk now, you're trying to tell me that after this whole episode that we just had today, somebody will still sit down and said, I still want to go under the knife.
Right now, as we are speaking, there's somebody on that table.
You know
There's
they
somebody.
enter.
There are thousands of people,
Wait.
both locally
No,
and
you are not
internationally.
getting me well. You mean with all this discussion now, somebody will still say,
We are not about
way
to
you dey
discuss
talk,
it.
that way they talk, now your own in they
So,
talk.
so for what she said, you have to know that BBL is not a quick fix. So you don't just get a
I mean,
BBL
I'm not a
and
doctor, but
you
you
have
heard
the Coke bottle or the hourglass shape you want. No. So after the surgery, there will be swelling still around it, inflammation. So you have to be on a pad, like the pad the
Oh
bum
God.
for
See what I'm
God.
saying? You have to be so careful.
so for 2 weeks you won't sit down.
You knew.
you won't
I've
sit
seen
down.
videos.
You
You
won't sit
knew.
on your bum. So you have to lie on your tummy
Flat.
or on the side. That is for 2 weeks. Then for the next 6 weeks, you won't still sit on your bum, but they'll give you like a donut chair, like a chair with something in at the center where you would sit down, and it would be really, really squishy, soft.
So that chair is supposed to help you mold it the more.
No, not molded more, just to avoid pressure,
Pressure so that it will not.
on the butt. So there is still
No,
swelling
what I
there.
mean is, you know that compression garment that they wear. What's the essence of the compression garment?
The compression garment is to help with the inflammation. It's to help at least to pad up the inflammation, it's not to mold it now. So just to put it, keep it in place, and to help with the swelling around the backside. So the desired effect of a BBL is seen after 6 months.
After 6 months.
So it's not like, oh, after this 1 month I would have this banging body. No.
So that explains why you see some people when they do the BBL, it's looking all good. After some time, you now see one up, one down.
So this might be
Doctor, I think doctor is trying to say that what you desire from that BBL can only be seen after 6
6 months when all the swelling
They have gone down and all
gone
the-
down, then that is when you now see actually what the doctor did. The
After 6 months.
extra fat that was put
Half
there.
of 1 year.
Yes. So it's not a quick fix. Like, oh, let me just do it.
And you're talking
in
about
2
But if I
months.
give that same time to the
To
gym,
the gym, exactly.
And
So
you're saying that you're not going to be sitting for like how many weeks?
for 2 weeks at least, you won't sit like this, like normally.
You won't sit
You have to
normal.
stand or lay on your tummy for 2 weeks.
For 2 weeks.
Yeah.
Then after 2 weeks,
Then
my
the next
God.
and I
6
see
weeks,
and I see some of them when they are walking, there's always this pipe. What's that pipe attached to them? They have this bag
so
that
that's
they
the
hold.
catheter bag.
So they hold it and they are going to the restroom and they come back, they lie down, they have to eat on their tummy. Please walk us through those process.
So after a BBL, in some settings, it is done as an outpatient procedure. So meaning you go home on the same day.
Oh, okay.
That is really good because it would help prevent complications like a deep vein thrombosis, like a clot going to your lungs or to other parts of your body. So some doctors would advise for early ambulation, meaning to start moving as quickly as possible. So they can send you home on the same day, and you might still go home with a catheter. But an aftercare, like a nurse, might come maybe the next day to take the catheter off so that you can go to the toilet by yourself, because the catheter is for urine to pass from your bladder directly there without you going to actually pee. So that is one of the aftercare, which I can't really say.
And then the massage.
The massage, oh, definitely. So
Do
it's,
they take drugs,
so
injections?
definitely you have to antibiotics basically and pain medications.
For how long?
Not so much, tops 1 week. So depending on your pain threshold, if your pain threshold is like ours, then you might take for a little
Someone
longer.
like success now, she cannot do that one. She cannot. She cannot do
I
that one.
can't. I can't. And I know that there are people. You people. I know that me like you, we the both
Me
of
like
together of us. You know, I really know that there are people like me out there that have zero tolerance to pain. I don't want it. Like the moment I feel any part of pain, around me, the next minute I'm looking for something to get it out. I don't want to feel that pain. So why would I want to go for something that would, give me a pain that I know if I remember it, I might go crazy. And then me thinking of, oh, what if there's a complication? Oh, I have to go through this pain. And doctor mentioned something. Doctor said that sometimes there's a kind of complication that happens. It now happens around the whole body. It gets to affect the
Sepsis. Yeah. Sepsis is like an infection
Sepsis.
that is not local anymore.
Yeah.
Have you seen
That
a
is
video
now-
of sepsis?
no, I
Picture.
don't
You
think
see some
so.
people, they have holes in their
The whole
body.
of their
Abi,
body.
am I wrong?
Maybe
You see,
not, maybe not, not
there are
exactly that.
some cases I've seen that they have wound on their
Please,
skin.
please, we are on live TV.
Out.
Doctor, I want to ask you, like I asked before, should a man be doing BBL? We are men. We are the only two men here.
Although there are cases of men that went under the knife, but I think it's more of fat reduction. They extract fat and then they do tummy tucks.
Yeah, and
I think
also,
there's the rumor has it
and-
that a popular politician went under the knife.
He didn't survive it, too.
There's someone that I heard that went under the knife, not in Nigeria here. I think there are also one other celebrity that they said, but he said, that said, and nobody's coming out to
I'm talking
say.
about BBL. What concerns a man with BBL?
So as the topic of the day says, my body, my choice.
Exactly. If I was going to
I-
answer, that was what I'll start with.
I'm a proponent for everybody owning their body. So do whatever you want to do with your body, but take into cognizance the effect it's going to have on your family, the effect it's going to have on your friends, and the local health care setting in your area. Because you do something abroad and you come back here. For example, I witnessed a case where a lady did a BBL, but she did what we call an allograft. Allograft means where some other person's tissue is taken and put in the backside, not her
Not
own
her.
fat. Because why? Because
Let's come back again.
okay,
They will take tissue from
someone
From you
else's
and put
fat
in me.
and put
Why?
So why is because this lady is a lean lady. She
Oh, she doesn't have fat.
She doesn't have her own fat.
Oh,
And
okay.
they told her that, listen, you are not a candidate for BBL because we don't have where to extract this.
Oh,
fat.
sorry, Doc, to cut you short. Sorry. So there is actually a level where, when you come, they can tell you that you're not qualified for this.
Oh yeah, this is.
Oh, really? So it's not really fully
It's
about
not
my body, my
everybody,
choice.
yeah.
So it's not.
No, they do an assessment.
Okay.
They check your BMI, which is your body mass index,
Yeah.
and they check for places where they could harvest this fat from.
Okay.
So this particular
So
lady.
if you don't have enough,
If you don't
No,
have
they
enough.
told her that you are not a candidate. You are a candidate for silicone implant. So just put a silicone there for you, and it pads up. She said no. She wants natural look.
Natural.
So they said, okay, we're going to do an allograft where we would take someone else's fat tissue and put in yours, but you would have to be on immune suppressants. So because any foreign tissue to the body has to react. So when they do like a kidney transplant for somebody, they give them immune blockers to make the body's immune system calm
accept
down,
the
to
new-
accept it. So they told this lady that you'll be on immune suppressants. I don't know if she understood the full gravity of this, and she let someone else's fat cells put into her butt, and she started coming down with infections every week, every other week. It's flu, it's cellulitis, and they had to take everything out. It almost took her life. I saw that firsthand. And if you see this lady, good looking lady, and all
In
she was
Nigeria
looking
here,
for, yeah,
or-
in Nigeria here,
So it happened for Niger.
yes, and all she
Wait,
was
the
looking for
lady
was that.
who they got that thing from, did
Just
they...
got a free tummy tuck.
Okay, so they'll tell you, we'll give you free tummy talk.
Oh no! They
No.
have to harvest the
From
fat from
someone
the
else.
tummy.
And that's what I'm saying. Is it that
So-
they'll pay her or...
Definitely. So
Okay,
they'll pay the person
they'll
that
have to pay.
Yeah, they'll pay the person that they are
Amazing.
taking this fat from, because it's not yours.
It's not yours.
It's not coming from your body.
So I get to pay for trouble.
And I don't know if she understood the full
Even
gravity.
I get to
of
pay
that.
for my own death.
So yeah.
So
it's-
people actually just come to donate. You know, up to recently, I heard that people sell their eggs, which I think will
I
also
had
have...
that
we'll-
back in school.
We'll
I
have
had-
that.
They donate sperm.
We'll have
I
to
had
bring
a
you back.
first-hand friend. I
We'll
had a
have to bring
first-hand
you back to
friend
talk
in
about
school.
that.
In Port Harcourt, she went to Port Harcourt to do hers. If she sees this, she knows I'm talking about her,
To
but
do
I'm not going
what?
to mention name. To sell her eggs in school then.
It's a new... It's trending
yes,
now.
we had school issues then now, okay, we afford school fees, we can't, a lot of people make choices and must graduate anyhow. So that, like I said, there is always a better option for something. I'm not saying I'm perfect, but I actually had options for myself, so I chose my own side. Other people too chose their own side. I mean, like I said, I don't like pain. And when she went and came back, she was talking to us about the pain, in selling, harvesting those eggs from you and she was even saying it. Me, myself, I've died like 10 times on her behalf because I don't like pain, which is why I didn't go for it. But a couple of friends also followed suit. They went to Port Harcourt.
How
they
much?
got it done.
Do you have an idea of how much they sold?
I said then they were giving like about 350, 400.
To sell egg?
Yes.
if it's for a good cause.
If it's for a good cause,
If
maybe
it's
a
for
child, a
so
baby.
if it's
or
for a
something.
for a good cause, because
Wait,
they are,
oh, sorry, because it says a good cause. This egg is my egg, and an asset of somebody else. And God forbid, maybe the person whose egg was sold is not able to have a child, right? Do I have claim over that child? Because now my egg.
So there's a document that you have
That
to
you have to
sign
sign
and
it.
everything that this you would you will not even know who
It's more
you're
like a
donating to.
surrogate.
Yes, you will not know
You will not know who
giving
you're
it to.
donating to. So
What if I know?
You
What
will
You
if-
won't know.
will
You won't
never-
know.
they
They'll
won't
have to
allow
keep
you
it
to
away.
know.
you would never.
won't know.
ever-
Most
Won't the child look like
Most
me?
time, even kidney
No,
plant.
I don't
No,
think
there is
so.
a sperm that
There's
would
a sperm
that
that
would
fertilize the
fertilize
egg.
the egg. So what if it takes on the
What
father's
if my gene is stronger?
you don't have any claim.
You don't have any claim that
in the
this is your
future,
child.
if this child wants
Wait,
to know,
oh, you guys, that means you guys should start suspecting this look alike. Oh. Because if I go outside and I
Do you
see somebody
understand?
that,
Even
hey,
though they look like one of my friends.
Every day you get to see people who look like you.
Yes.
And you're not going to place a claim, oh, she's my twin or she's my sister. You're not going to do that. Because, I mean, anything can happen. This is a very wild world where everything happens. So they did it back then in school. So, yes, people are doing it for money. Just like the first question was thrown at me, and the doc asked me and said, can pressure push someone into making decisions? Listen, I would say this as we're rounding off. As a lady, you have the right to make choices for yourself. But one thing I know for sure is make sure that whatever choice you're making for yourself or whatever thing you choose to go into was prompted by you. No one pushed you into doing it. Because let it not be that, at least when you're having the regret, you hit your full chest and say, I did this myself. Nobody pushed me into doing it. Do you understand? Than having to be that it's a friend or something you saw on social media or missed there or, a promo or anything, or I want to have this body, what's trending. Don't let it be that it's a trending stuff or pressure, this youth pressure. Oh, I want to look like this girl. Aesthetically pleasing, that's what they call it. Because you want to look aesthetically pleasing, you go and make choices out of pressure. I want to. No. Make sure that whatever decision you make
It's by
about
you.
your body, your marriage, your lifestyle, your business, everything is you. So that whatever results that comes out of it, you hit your full chest and say, I made this decision and I did it. So let it not be that you are being pressurized by friends or by anything. I have a rule. If I have a friend that is pressurizing me,
You cut
I
it
will
off.
be happy for you, but I step back. You can't, like I mentioned it in the last podcast. I don't think anybody has ever made me do what I don't want to do. No. So be that type of person. Be happy for them. Be happy how they achieved what they achieved, genuinely. But if you feel pressured by what a particular person is doing or achieving, remember that you don't have the same life with that person.
Okay, so
Step
Doc,
back.
you were saying something
Yeah.
before the other one entered my head, and I'm wondering how people would donate. Is it that this practice is new? That's for the people who's what do you call it? That helps people transfer. Is it? Are there
Allograft.
cases?
So I have this is a very rare case. I've never seen that done. So I don't know if I don't think it is legal, because again, if you come with a certain body type or you're lean, the doctor will tell you you are not a candidate. And if you insist, some any doctor that is working under ethical bounds will tell you you might want to seek a second opinion somewhere else, because I can't go
I
ahead.
can't handle this.
I can't do this. So for that person, I'm sure the doctor said, okay, we'll get it done, but we have to take from some other person. And this lady, because of maybe insistence of getting the natural one, said no problem. And I'm sure they also told her that, listen, you are going to be getting this very, very weird and strong medications to suppress your immunity for some time, because your body might reject this transfer, this part, because it is not your own body's tissues. She said yes. She said yes.
So the thing about this surgery is,
Yes.
I think, is addictive,
Hey.
because you over time, I think you can rarely find someone who goes for surgery, this cosmetical surgery, and they are satisfied. It's either they go for the backside and they're like, okay, let me augment the upside, and at the end of the day, they just keep botching all their bodies, you know. They'll go for to the level where they are now looking all plastic. Why is it so? Is it that BBL is, no, surgery itself is addictive? It's like a drug, because this thing, I think it has to do with yourself, knowing your self-esteem, your self-worth. Because
That's what
if
I
you don't
drive at.
allow,
That's
if
why I
you
said,
don't-
yeah,
if
that's
you
what I
don't
mentioned.
allow the
That's
society
it.
to
Gets to
define
you.
what beauty is, because oftentimes, especially on our adverts, and I think the media is contributing a lot to it,
And celebrity.
you will not see them use plus size. They always use Coke bottle
God bless you.
shape for advert. When you're having they want to launch a product, you always go for perfect body. How do we define
Please
perfect body?
let me bring this in. I'm pursuing a career, to be an actor. It's been a long time thing, and by God's grace, I've featured in 1 or 2 series, and I'm still pushing. Still praying to God for more open doors and all. Let me give you a crazy example. I went for an audition. I was very good. The director, I won't call names, neither will I call the production. Through a connection I got there, the director looked at me straight and said, "Success, you're very good, you're very talented, you're outspoken. In fact, you nailed this role from the audition we just did, but I'm not going to give you this role."
Why?
And I said, "Okay, why? Is it my age or something?" He said, "No, that you do not have the kind of body we need in this industry." He didn't say, assuming he told me in this movie, I would have said, okay, maybe they are trying to portray a particular character and they need a body size to portray that. He told me because I am a plus size, because I'm big, that Nollywood won't really work for me like that. That what I should go and do is Asaba Wood, that where they can always use me as a second wife, that I will cash out very well.
Are you
The
serious?
director told me in Lagos. Yes.
In person.
So now you see, this is also part of what we're saying. I go for that audition, and a director who is supposed to help build me. If you just wanted to say no, tell me no. than telling me that because
Body
of my
shaming.
body shaming me and telling me that
that's
I
it.
can't survive in this industry. Are you every other director? You're not. That's a full body shame. And I would go if I never knew who I was. You know, if you
You
talk
go
to
home
success,
and you feel
go ask
bad.
them, ask people around me. The last thing you can do is tell me something that I don't have a knowledge of. I know who I am. I know myself. Nobody tells me otherwise. Assuming I don't have a confidence of that. That is why I tell ladies, know yourself. What is making
Believe in
people
yourself.
work
Confidence.
like this? If you know yourself, nobody can tell you anything otherwise. And assuming I don't have that self-esteem, what that director said to me will make me go home. I would cry, and then after crying, I'll start seeking options. And before you guys will say the director that made me lose weight, I'm actually on a weight loss journey for myself. I want to. Yes. So because I'm going to change
Yeah,
shape
before they will say,
before they
"Oh,
will
she
say it's the
said it, that's
director.
why,"
No, no, it's not
yeah.
your director, my dear. If I didn't have that self-esteem, somebody else who can take it will go home after crying, will start seeking for options.
Does this explain why it seems like a trend? Almost everybody in our movies are having this.
My goodness.
Almost everybody, and most of these people are not talented. Is it that they are rejecting pure talent because of a particular stereotype?
Let me finish. Assuming maybe the person does not have a self-esteem, the lady might want to opt for, please, what can I do to get slim immediately? What can I do to do this immediately? And that's where the pressure comes in. Now that's where I think I have 8 million naira. Now go do this body quick. And you go get it. You didn't think at that point, it's only what the director told you that is
on
running
your
through your
head.
head. You're not thinking, okay, if I get this body done, what's the maintenance level? What am I going to use? What is my finances like? You're not thinking. And you're like, okay, now I would be accepted. No. Don't let anybody place you in a place where you have to look a certain way to be accepted. With your full chest, know yourself that I will walk in anywhere and I would be accepted. And nobody, not even the president can tell you otherwise about who you say you are.
Right.
So if you have that full confidence, nobody moves you. And that's why I say when I say something, people who know me
You own
personally.
it.
When I say something with my full chest, that is why when I make decisions and that something goes wrong, I hit it with my full chest and say, Nami caused this one, Nami do one. But at least I know that no one actually prompted me to do so. So if you generate that for yourself, no one, and I know I will still make it in Nollywood. I'll still get there.
I think
But
this thing has
not
been,
with the director.
I think this thing has been from the beginning, with women. If you permit me to be a little bit religion on this, when the serpent came to Eve, he said, "If you eat this, you will be like." If you do
You
this,
don't carry us go where we know.
because women just
Let's
want to
bring
be
it
like.
It started. Oh, we want to be like. So from
You
the
will be
beginning.
like. It has been like that. The serpent said to him, "If you eat this, you will be like." So if you do BBL, you will be like Kim Kardashian or whatsoever it is. So what I'm trying to say is, if you're not confident about yourself and you don't know yourself, you will always want to go for the next option.
Yes.
That will make you to look like
yes.
what you think you are not. Because before Eve ever took that, whatsoever it is, it was already like who the devil was tempting her to be. She was already in the image of God. And then somebody is telling you that if you take this, you will be like God. But she was already in the image of God. They say lack of knowledge also contribute to this.
I think in Eve's defense, Eve wanted an upgrade. There's something about women and growth. Yeah. In her defense, she didn't know that it would lead to that consequence. I'm sorry, Eve, I'm not here. I'm not there wherever you
so
are.
that's why we're actually talking about this topic.
Yeah,
So
I
that
think
before
she just
you're
wanted an
that
upgrade.
Eve that makes that choice to upgrade,
Yeah.
make sure you look at, the doctor mentioned it earlier. He said, before you go in for any medical
Procedure,
care,
think about the
procedure,
cost.
surgery, anything, make sure you ask about the doctor. Not just the doctor. It takes a village to perform a surgery. Make sure you get to know who the nurses are, the success rate of what you're about to do, and all. Even me, if I want to register at the gym, please, I will try and look at people who have gone to the gym consistently for 3 months. What was the result like? Consistently for 1 month, what was the result like? Before I can be able to say, okay, fine, I think I should enroll in the gym. I'm hoping with my consistency, I would get the same result.
result.
So there's always choices for you to make. There's always A, B, C, D. And in between these four, there's always a better one than the worst one. There is always a better one than the worst one. So yes, always
so
go for the
doctor,
one that is better.
Thank you so much. You said something that I'd like to chip in.
Okay.
I think we'll just digress a little, talking about people who have been rejected several times by filmmakers. At the end of the day, you know, the thing really affects their self-esteem. Please, you don't, at this point where we are, social media has given you such a great platform, right? If you go for an audition in somewhere and you get rejected, you don't necessarily have to, it's not that particular movie that will take you out. I have seen content creators who all they did was carry their phone, did one funny thing, and the internet made them go viral.
I'm here
And
today
the
as a result
so-called
of that.
directors are on their DM begging them to come and shoot for them. So you don't necessarily have to be on one part. If they say no to you,
Keep
please
doing what you're doing.
reinvent yourself. I'm going to use success as a good example, right? You had an issue with the director. True or false? You had that issue with the director,
Sure.
and that didn't stop you.
No, we didn't.
Rather, you used your phone, you used what you have
Yes.
to begin to.
I keep shooting my
to
monologue every
shoot
week.
her
I keep
monologue.
doing
And guess where I saw her? It was on one of those videos. I saw the video and I was just talking to Doc here, and I'm like, oh, I love her confidence. I love how she speaks. I've got to have her on the show. And voila, she's here. Not
Yeah.
just the first time, this is the second time. So
Yeah.
don't wait for opportunity.
Yeah.
Don't wait to be on a particular section.
You don't know that
The-
video.
the-
you don't know that
you-
video that
yeah,
will go.
you
That's the
don't
thing. You
know.
don't know.
Pick
I
your
just
phone
did a
and
no-
do
I
it.
just did my normal
Yes, your normal run.
fucking routine. I just did my normal rant on my mirror, and that was it. I woke up the next morning and my phone is buzzing
You know,
everywhere.
you just went
You
viral.
don't know the video. You
It
don't
went
know.
viral. And you know, I also want to use Ruth Kadiri, right? I will use her as a good example too. At some point, it seemed like they were choking her in Nollywood. They were choking her so much so that they didn't want to give her a platform. Do you know what she did? She just opened her own, went on YouTube, and before you know, she's, if you are to count the top 5 movies,
She's at number 2.
if you, do you
She's
understand?
if she that's if she's not the number 1. She's she's there.
So
She's
if
very
they
good.
refuse
She's
to
very-
allow you
Now
to
she
sit on
tells
the
her stories
table,
with her body, with her size. She
yes, I
tells
think,
what happens
I
now.
think one of the issues they were pushing her back was her size. They wanted to use it against her. Please don't quote me, but I think that was one of the reasons that they were not giving her jobs and all that. Which, please, if you're listening to this, Auntie Ruth, Miss Ruth, please, we'll need you on our show. Thank you. I think her body size was one of the reasons, because they were giving her a lot of conditions and all that.
She's not the
She
only
just-
person. Too.
yeah.
I'm going to say this because she has come out to say it. Blessing Obasenze is a woman I love so much. I love her so much. I mean, and if you look at some of the ways I act, you will know that I'm copying some of the things she's doing. I look at her a lot. Blessing Obasenze literally said in an interview, and you can quote me if you want to. She said she got tired of what was going on with the directors and everything, and her body. She said she literally shoved herself down the throat of directors. Now, for you to pull Blessing on Basense, you got to know what you get now. She's a she now. For you to drag her, you go no now. She kept on doing. She didn't
She
let
didn't allow
anything
the
stop
pressure.
her. She just kept on moving.
Yeah.
And of which, if I'm looking up to these people, as I am going, these are people that motivate me. I'll keep doing what I'm doing. Definitely, when the time, there's something about timing. When the timing is right for you, trust me, nothing will stop
Okay.
you. So just keep doing what you're doing. Something will pique you. Keep doing what you're doing. Sometimes I post on TikTok and I'm seeing 200 views. This is somebody who has gone viral so many times. I see this 200 views. I will be so, what's going
What
on? What's
happened?
happening now? I think I've already gotten there where people like me and everything. Sometimes I feel reluctant to create a video. Is it the one I put my efforts now and it won't blow up? I beg you. But something in me,
Be
that's one
consistent.
thing about having passion
pushing.
about what you're doing. Something in you still says, shoot that video. Just do it, because social media has a power that is so underrated. The power of social media is crazy. Like, social
They
media
can make and they can break
Thank you. That's what social media is all about. So keep posting. You don't know.
That video.
You don't know who's watching. You don't know that celebrity. You don't know that director. Even as I'm talking now, you don't know who's gonna come across this video. So just that thing you know how to do. Forget about who doesn't see you. Forget about who doesn't know you. Keep doing you. You're gonna come out. So don't let anything pressurize you to do what you don't want to do or to stop being know yourself. If you know yourself, nothing.
So, doctor, okay, as we round up, for you now, aside the monetary gain that doctors they make out of, because it's expensive. Do you see yourself carrying out? Is it something you like to do over time, like start doing BBL for people?
No, not exactly. My field of focus in the future would be women health. So not exactly cosmetic.
That's general health.
Yeah, my sister told me that I should go into it so I can do for them. I have 4 sisters. So they said I should go into
Like a
cosmetic
guy now.
surgery. Yes, that is what I want to. I want to specialize in the future, gynecologist. But my sisters told me jokingly that I should do cosmetic surgery so they will get
Free body.
Oh my
Free
goodness.
body and free maintenance if they want to.
That's right. But what would you advise someone to go for it?
Absolutely, yeah. I've seen very, very good, very, very, very good work cosmetic surgeons do for born victims or people that have extensive burns. I've seen that, and it's like a work of art. And as you guys mentioned, there are some BBLs that if you see it, you don't know that this person actually
You won't know.
did their
It's so
body.
beautiful.
So under the care or skill of a very, very, very skilled surgeon, cosmetic surgeon, I swear, this is a very safe procedure. Really, really safe. If you do it with someone that is very qualified, that has a degree, that has done so many and has very, very, very good success rates, I think it's a really safe procedure.
Yeah, if you have the money and the
you can
maintenance.
get the outcome you want to match your expectations, because of course you have to have expectations, and your outcome of the surgery would definitely match your expectations.
So as a doctor, BBL or gym, which will you pick?
Well,
That's a tight corner.
yeah, you're
Because
putting me on the
it's
spot.
his profession.
You're putting me
Yeah,
on the
'cause-
spot. So, I would still say to opt for the natural one. So whatever you could get naturally, I would all day, every day. So go to the gym, walk, because again, it's not a quick fix. It's not something you get after 1 month. It's something that would take months for you to see the effects.
So if you still wait the duration,
Yeah,
you would
so is
rather
the
go
gym.
for the natural
So
way
is
of
the gym.
getting it.
So if you're consistent with the gym or diet and not being sedentary, sit at home and all that stuff, I think you still get
Wait, let's go back. Sedentary.
yeah.
Explain it to us.
Oh, sedentary lifestyle is like not being active. So your job is a desk job. You're seated at your computer for 7-8 hours.
Does that make the backside fly? The uku, does that
No. It makes you not gaining weight in undesired areas and being generally unhealthy. Yeah, so sedentary lifestyle is something that you should kick off if you want to look a certain way or be healthy generally.
Wow.
Yeah, just like I kicked mine.
Okay, so you have to, if I have to do, I'm just taking at it now logically. 6 months, I'll see my desired result after BBL. 6 months, I'll still see results if I go to the
Consistency in the
gym.
gym.
One is cheaper. The other one is expensive. What would I have to opt for?
The other one even has less complications. Less complications.
So it's the pressure, as she said, and of course, some people are doing it for sinister reasons. So maybe some people want to get one particular man or person,
Yeah.
and they want to look, or they want to get into the Nollywood
Nollywood.
industry, and they want to show them, they want to pepper the girls or something.
Because I feel like, sorry, BBL, team BBL, I feel like some of them, I know they will come for me, but I'll bring it on, right? I feel like some of them, after they do it, the only way you know that they do it is to come and shake, yeah? shake it. And
mm.
it's their content.
Mm.
If you want to know a girl that has done BBL,
Always displaying.
that is their
course,
content.
Because
you
the
want to
ones that
show
have
it
it
now. You
natural,
want to
because
show-
the ones that have,
Do you know how
like,
much?
So
the
I'll
ones that
go through
have-
all
the ones
those
that have-
things
is
just to
that?
come and.
the ones
you
that
know how
have
much they
really
spent
nice
on it? How
shape
can you spend
naturally,
so
they
much
hardly
money on that and you will
even
not do it?
they hardly even come out to show it. Sometimes when you talk about it, they say, I beg, I beg, I beg. I don't know why God go carry this kind of thing. Give me. You understand? I'm talking about people who have it naturally.
And now,
they
compared to somebody that is
compared
money,
to somebody who use money. So
And you say
if
you
I
not
use
show
money
it.
to get something, I want you. Have you seen iPhone users? Hello. If I get iPhone 15 now alone, that my mirror I used to shift small. I
You
will
not
put
shift
the
it.
iPhone 15 so that the three camera
can be sure.
so that the three camera can be showing. Do you know what? I'm holding a one, but hello, excuse me. So there's this thing that comes with when you get something
Expensive.
of expensive. It's natural.
So it becomes the content.
So because they acquired it in a very expensive way, I will buy that gown. Oh, I will wear it. I will show you that I got it.
Then you put your camera, your
It's also
phone.
a form of advertisement.
Yeah, and it depends
Uh-huh.
on what you're advertising.
That's true.
It depends on what you. Last week there was a celebrity that came online, and when this whole BBL, people, being unalived by it and all, there was a celebrity that came on and said that she regrets getting it. She said it on her page. She said, I regret getting it, but the only thing that pushed me to getting it was I run a clothing brand. And when you call models, people, when they see clothes on mannequins are nice, but it doesn't really convince them, like as much as it does when it's on someone's body. So she said, getting these people to model my clothes was, because I'm a celebrity, was costing me
Much.
a whole lot of money just for them to come and wear an outfit and get a record of it. So she said she went in for it to have the body, and now she models her clothes. I mean, that's a good drive to going for it, and considering for no,
That
let
one
me
is
complete
sounding
it.
somehow.
No, let me complete it. Considering who she is and the kind of money she has, if there is a complication, she can run it. If there is a maintenance, she is already maintaining it, because this celebrity doesn't even, if she didn't come out to tell us,
Because
she did it.
if you're saying that it's because of that, they have
That's why I'm
butt
saying-
pad, hips pad that you can quickly
Exactly.
wear.
That's what I'm
So
saying.
I
That's
don't
some
think
type
that is that is just one of the excuses.
excuses. That's what I'm
Yeah,
saying.
but I don't think
to
that
her,
should.
that's some of like some sort of drive
You know
that
what?
pushed her.
Let it be.
Do you understand? Like that's what pushed her. She said, I'm talking about like if I was in her shoes. Because according to what she said, yes, I regret it. But this was the major reason I went into it, to model my brand, to model my clothes. But just like I mentioned earlier,
That thing, it doesn't sit
there
on
is
me.
option A, there is option B, there is option C. There's always options. So instead of you going to get that body, just like you said, there are body wears that could
There are
have
body
just,
wears.
if you had worn it and displayed your clothes, your face is what we need. You could have still sold your brand, and when you're done, you pull it off and you're okay. But only if she thought about that.
Next time when we're going to be having this topic, we need to bring somebody that have done the video before. We need to hear a first-hand experience.
Okay.
Because there are many things that we don't know from their own perspective that they are going to share with us. I would think will make a little more, give us a little more information about the whole thing. Somebody who have gone through the night by herself, coming to share our own experience. Some people might have a negative experience, others might have a positive experience. And so for all our viewers, I think
But the thing about the Niger factor is most people don't even agree that they've done it. It's only people who are unapologetic about their.
Yeah.
There are some people just go, they say, I wake up like this, they go to the gym, they tell you it's gym body, shake what, doctor. Some people are living in denial. Like, I can't imagine myself spending 10 million to go for a procedure, and you come and say, did you go and do your body? And I went to the gym. Went to the gym,
I will tell you in case you're thinking, so you know it's not the gym. And just like the doctor said, you don't get that result immediately. It's still the same time frame for you to get exactly what made you do it. It takes about 6 months, 7 months. So instead of there's an option A, B, C. Which should I go for? If, like I said, pain, I don't stand pain. But you see that gym pain, I've already started taking in little of it. And I was able to explain to my gym instructor saying, I don't really like pain. But he said here, no pain, no gain. But at least I know that that pain is something just to get what I want for that time. I don't think that the pain is going to escalate. I don't know for people who go to. I don't think I'm going to have an after pain when I have my
I
body.
think the pain will come for the gym, maybe
And some of them,
1,
yeah.
2 weeks
So,
or
and some
1
of them will
month.
tell you that gym pain actually comes in much when you start kneeling,
Yes.
which is true. But
Yes.
once you get used to it, you
No.
come there, you do your thing. You now see it as a fitness, exercise that you just want to do. And then once you're done, you go your way.
Wow, thank
You
you.
get. So
Wow.
it's not something I'm expecting a complication after.
Wow, thank
So
you.
there's always an option B.
Wow, thank
Yeah,
you.
awesome.
Doctor, as we wrap up, oftentimes we've seen people sell products that enhances the butt. They'll tell you there are creams that you can apply to enhance your butt to make it bigger. There are drugs you take to make the butt bigger, and also there are foods, some kind of food that you take to enhance your butt or a particular size of the body. Do those things work?
Those are they're just fake stuff. And I think whatever you're applying on your body, just make sure you read the contents. All those things they're not real. So, but still be very, 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 very sure of what you're applying on your body or taking in. To be sure that there are not any harmful substances to your kidneys and your liver. Because those things might contain steroids that you don't need.
Do they work in the first place?
They don't. They don't. Honestly, they don't.
Well,
So
how
all
come
those
there
before
are-
and after
How
picture
come
we
they're
used to
always
see.
sharing like a before and after?
I mean, we live in a digital age. You
true.
could do
It's true, though.
anything.
It's
You
true.
could augment any picture with Photoshop, or you could take pictures of people's before and after that is not related to the product you're selling. It's pretty easy.
Okay,
So-
so there was one I saw. Apart from those drugs, they said they call it body is it body sculpturing or body contouring? They use machine, they apply it, and I think that the machine is like a vacuum, as in it sucks in the butt. It sucks it after it releases it, and they said there's a lady that
Oh,
when
there's
she
round.
yeah, there's a lady when she started, a young lady. When she started at first, she was making money. The other day I went to her page. That lady, she bought a house by just doing that. They'll tell you they have things that they'll use to, remold your body, and then there's one that they'll put on the body, suck it out, all those
That was
things.
that was the question I wanted to actually ask him.
Mm.
Doc, is there? I'm not the host, but I love
Yeah,
knowledge.
yeah.
I love to know. Is there actually a natural way that somebody can enhance
Aside gym.
their body? Like the boobs and the backside.
No, these are genetic stuff. So you're born with a particular genetic makeup. The way you store fat, the way you grow muscle, the way your skeletal makeup is, that is the way you were born. That is the genetic that your mom and your dad birthed you into. There are no natural ways for you to, for example, make your muscle grow bigger than normal if you don't go to the gym to actually build the muscle.
Build it.
There are no natural ways. No.
So it's the muscle you build and not the fat around the
When you go to the
hip
gym.
area.
When you go to the gym.
Because these people, they make us. So I'm just trying to look at it logically. If I have to build my muscle to get that Coke bottle shape, why do I have muscles are not built with cream, right? Why do I have to buy a cream that will now give me the shape?
I think
What's the logic behind that?
the doctor was saying just a few minutes ago that all those things are fake.
So this is just preying on the gullibility of people. This is classic
Please be careful of what you buy.
yeah, so I mean, this is Nigeria, and people will prey on your gullibility. So if you want to lose weight, I'm sure there are 2,000 different things that someone will come and try to sell to you and tell you that, oh, this you would have results. Or if you drink water 2 liters every day, you have results. I'm sure there are people that will buy that will subscribe to that. So it's just to be very careful, do your research, and just try not to be as desperate and gullible, so you don't just take harmful things into your body.
Yeah, the
Thank
content
you.
matters.
Wow.
The content matters. To read what's on the body of what you want to do.
So
or
those
something.
supplements that he said would add. I think recently one ex BBN that's BBN candidate. She said there are some food she eats that makes her boobs very big. She named it. And I'm
I don't
like,
know, but Doc is here. But I feel like normally as a human, there are intake of foods that make you, makes you healthier.
big on LV side.
No, that makes you healthier, not big.
For sure.
Not big, that makes you healthier. So I feel when you eat healthy, it's covers every part of your body. I feel
It does.
even
but
your skin glows naturally
definitely
and all.
with vitamins and all that, but you wouldn't have a rounded and hourglass.
That shape.
You're not going to have a
That
hourglass
shape.
You're not going
if
to
you
have
don't
that.
work on it.
If you don't
So it's either the gym or the knife.
exactly, or genetics, because
genetic-
there are some people that
yes.
are born to very, very good genetic makeup, and when you see them, you think they go to the gym, but they don't. Just that is how they look.
That's how they look.
That natural.
Yeah.
You're born with it.
My younger sister, for instance, she looks just like my mommy. She has everything. She looks like everything.
It's
just like my mom.
People will
She didn't
prey
do
on-
anything. A lot of her friends, oh, you did this, you did that. I don't do caca. This is how my mom is, and that's how I look.
And you are the eldest.
Yes, I'm the first letter for
Hey.
child.
Wow, thank you so much,
Awesome time.
Dr. Mark. It's been a wonderful moment with you.
you.
Having you to share from experience and also share from your wealth of knowledge. Thank you
you
for
very
coming
much
on
for
the
having me.
show.
I mean, my knowledge has expanded. I never knew that you could take another person's tissue and put it in someone else. I
Yeah.
never even knew that could exist.
I never knew that was a thing.
So I learned. It was
Yeah, the
very-
only one I knew of was kidney transplant,
Yeah,
all
and
those
all that.
things. I don't know that
I
people.
think for the first time today, I saw that a man can also do BBL.
So
I've never had it
it's
before.
quite a humbling experience. It's an eye opener
Yes.
to not just bring people that will just rant and talk about it. We bring people that are in the field, come share the experience so that someone watching this out there would know. Because at the end of the day, some people still go in the comment section and say, "Me, I'm still saving money to do my own," right? So this is for people who are in genuine need of this particular video, because there are some people that really need an honest opinion. Because for you to go for consultation for BBL, it's not free. You pay.
It's not free.
Yes,
you
you pay. So here is we are giving you free consultation now. It's just that there was no test conducted on you to know if you can go for the procedure. So to someone watching this out there, please think it through. Don't just jump on it.
Exactly.
Think it through. Make sure you understand the pros and the cons, the advantage and the disadvantage,
Weigh your
the
options.
cost. I love how Success was talking about check your pocket very well. It's a journey that when you embark on it, there's no going back. When you take that first step to do that surgery, there are chances that you would want to go again, and you also have to do the maintenance. I think there's something I read, they said 5 years later you also go the routine check. I think you go 6 months, 1 year. Are you ready for that kind of a thing? Is it worth it? Do you understand? If you're doing that as a result of pressure, okay, I need to look as a model, I need to look a certain way for me to advance in my career. Do you really need to? She said something that I like to borrow. She said, there are always options to everything. Do you really need to do it? Are you ready for it? Mentally, physically, and financially. If you know that you've checked the cost and you're not ready for it, please back out. It's not a do or die affair. Do you get? It's not a do or die affair. And then ladies, please be confident in your skin. Be confident in your skin, because society will push you so much that when you get to the point where they have pushed you to, they will leave you. And those same people that are pushing you are the people that will, laugh at you. You don't need a lot of things going on. I know the media is projecting a particular skin tone, skin shape. Now there's so much pressure. There's the skincare,
Skincare.
and one product is going for 50,000, 60,000. Do you really need it? Please, moving forward, always think about the cost before you just go into. Don't just dabble
Yeah,
into.
Mabi, I'd like to say something. That was the video I made on my page about, body, skin, and all. And somebody came to the comment section. I really want to address that comment for every other person watching. The person said, I day young. Make I do everything where I want to now, where I day young. When I grow old, we will come out all those things, face old age, but at least I live and when I day young.
You can imagine.
I understand. I always bring my dialect wherever I go. People who watch my comments know. Ndi Igbo sị na, mgbe egbujiri, awụ mgbe ọ na-akpọnwụ. Do you understand? For you to make any decision, stop thinking only just now. Your life does not revolve around now. Old age comes with its own ups and downs.
That's right.
Don't borrow the problem of now and go and add it to the problem of old age. Old age, your bones are weak, your body is weak. And if you must have done so many things that affect your skin, affect your body when you were young, that's going to be a whole lot when you grow old. It's going to like add to the old age. So are you willing to like suffer so much when you're old for decisions that you made now? So to address that comment, remember that life is not just you. Don't be selfish about your life. Life is about your husband, it's about your children, it's about your family. Somehow.
It's about you.
It's not 100% them, but they come in. So before you make any decision, try to consider people around you, your family, and you later. The later me will. I love this. I saw a guy on TikTok talking about his tattoos, and people want to get tattoos. That what people who are craving so much tattoos all over their body right now don't know is that tattoos last forever. It doesn't come to your knowledge
Even with
until
the
you get
laser
until you
remover.
get. I don't know.
They use
Laser removal, but
to-
imagine somebody who tattooed every single part of their body getting laced all over. I mean, that would be so much. So before, I know you have the money, I know you want to have that body, I know you want to make that choices, but please, before you do that, always think of tomorrow. Tomorrow matters. They tell you tomorrow is not known. Please make sure you know your tomorrow.
And
matters.
BBL is raining now. What if in the next 5 years it doesn't rain anymore?
God bless
Because
you.
before the emergence of BBL has always been in practice long ago. People have
Yeah.
been doing it. But there was something that was trending before. That was the silicone thing.
Yeah.
It was trending. It was all over. Everybody was doing it. Up to many years, I think it lasted for like 10, 15 years. And then the so-called pioneers, people who championed it, had to go remove it.
Even the bleaching of skin.
Yeah.
There was a time it trended in Nollywood. It was only fair girls that were seen in
Yeah,
Nollywood.
yeah.
You would never see a dark lady in Nollywood. It was fair everywhere. And I'm speaking this because a legend in Nollywood I met on set, he's everywhere in the Nigerian movie. Like he said something. He said, now, that's how he talks. He said, now in the movie industry, you see all the girls with their big side, big sides, and their, their body enhanced. That is what is trending now in Nollywood. It would not trend anymore. Very soon it will not trend. So I don't know what they're doing, but I know it will fade away. That's how he talks. So the people that know that I'm trying to mimic it, they already know who I'm talking about. So I picked that knowledge and I grabbed that wisdom from him
It
immediately.
will last forever.
It won't. It won't.
So imagine you risk your life or
Yes,
something. after
the
5
capacity
years.
of your body now is not the capacity of your body when you're 80. So don't be doing many things now because you feel you have the strength now. Do something that even at 80, your body can still carry the things you did when you were much younger. I know you're young, you want to feel young. Of course, nobody's stopping you, but before you do that, try and look for what's better.
Wow. Thank you so much. All right, viewers, thank you so much. Thank you for the engagement. We've been seeing the likes and the comments and the engagement. Thank you for pushing our videos out on social media. For those of you that have been sharing, please continue to share. But while you're at it, make sure to tag us, okay? Give us the credit and we are good to go. Thank you so much. So until we come again your time next week, see you. From us, we'll say bye-bye.